Hello and welcome to this Transform Talk 1, which is on digital technology and data insight. We've got 30 minutes with colleagues to my left, and we're going to be discussing the detail of how to become a digital organisation. iESE has previously prepared and published a white paper on digital, and that set out an overarching strategy for how to approach turning a local authority into a digital organisation. But joining me as key speakers today are Craig Miller, Director of Street Scene from the London Borough of Barnet, who has a data-driven garden waste services project, and Joanna Jones, Partnership and Governance Manager, Carmarthenshire County Council, and Carla Dix, Strategic Innovation Programme Lead, Delta Wellbeing, who are dealing with a Delta Connect, Delta and Carmarthenshire Council project. And the idea here is to get these wonderful people to talk about what they're doing at the coalface. Rather than to deal with a digital strategy approach, we thought it would be better to actually take it down into the detail and say what's happening locally in key projects so that you can see what your colleagues are doing in other authorities to bring digital to life, to connect the local authority and its digital agenda to the communities. So I'm going to ask each of you to talk about your projects, and that will provide the opportunity for any delegates to ask any questions they may have. And then we'll go on to discuss how the projects began, what they involve, how they have developed since they began, what the challenges have been, what the problems have been, and what the opportunities have been, and what future opportunities they provide for. So without further ado, over to you, Craig. Tell us about your project, anything you want to cover in terms of the scope.
Great, thanks, John. So I've come here today to talk about the garden waste service that you introduced there. Barnet Council introduced a new chargeable service in 2020, May of 2020. It previously been a free of charge service provided to households. And what we're talking about today is how we used service data and service intelligence to really shape and tailor that service so that we could use that intelligence to give a responsive service to our customers, inform how we really engaged with residents, and listen to what they were telling us through that data to shape the service as we've evolved over, we're in year 3 now, how we've evolved that service. So when we first went to introduce this service, we had a bit of a hybrid model in terms of analog versus digital, I suppose how you could describe it, where we offered sign-ups to residents through traditional methods, through telephone contact, and we also had an online web form available to people, but I guess the hierarchy was more to telephone contact because that's what we thought people preferred and what people were used to. But what we did do when we started to engage with residents was we asked residents, actively asked them rather than giving it as an option, to provide us with digital contact details and their authority for us to contact them in the future about this service. We were quite overwhelmed by the response. 92% of the customers that signed up to service gave us those contact details. And in the contact we had with residents, there was quite a lot of desire for there to be electronic contact. So as we've gone on with the service, we have moved over to engage with people electronically. What we've also done is we invested a little bit of money and a little bit of time into getting our data sets, the data we were capturing, really quite sophisticated, so that we could start to utilise that to monitor how well the service was being received, but also how we could then use that to look at trends, so areas where we might have lower sign-ups over others, so that could then start informing our marketing of the service as we went on. That was really useful in terms of becoming a bit more intelligent about our marketing approach rather than blanket marketing. as people signed up, we could start to take them off of marketing lists so they didn't get frustrated by communications coming through asking them to sign up when they'd already done it, those kind of things. It also meant that when we came over to roll over from year 1 into year 2, we could start communicating early, reminding people to sign up. And what we found with that was really helpful in getting return customers. So in the first year, we got roughly about 90% of our customer base returning.
Wow.
And in year 3 that we've just gone into, we're at 91% of our customers returning back to us. What we also do with that intelligence and what those contact details is it's a fortnightly service, we're able to send out reminders to the customer. So we're starting to use this information to make our services be convenient, may be useful with the intelligence, if you like. So people don't have to remember what cycle they're on. They get a reminder from us to say, "But you've been out tomorrow." So we're making it as convenient as possible for the customer. We've also used this to shape our model in terms of how we fully engage with customers now. So as I said, we had telephone-based contacts at the beginning. In year 2, with the intelligence we got from year 1, we were able to reduce the resource that we put into our customer contact centre because the demand on the phone was reducing because our contact was through the digital route. And in year 3, we've dramatically dropped that. We've also dropped things like direct mail outs because we're now able to interact electronically with the majority of our customer base. So taking some financial efficiencies from that as well. But in terms of data and the intelligence we get for the service, so we're able to, through the investment we've done in analytics, quite simple products. We use Microsoft off-the-shelf Power BI product so that we can look at heat maps as to where people are signing up. We can look at how many people are, how many households are signing up for more than one container. We can start to see, insight into how people are using the service. And it's really helped us in terms of shaping our rounds, ensuring we get productivity out of the service. And that marketing piece has, really helped us interact with the customer in a meaningful way for them.
We have a delegate question. How do you collect and maintain real-time data so it's of the now and not outdated?
Yeah, so when customers sign up, they sign up for a year. So obviously, we make sure that when we're communicating with them, we'll ask them for, if they've changed their contact details, that kind of stuff, they can return that back to us. But obviously, as we start communicating out at the end of the year for the next year, that's how we then get our new batch of information from those individuals. But we do have mechanisms where a feedback loop where they can update their contact details with us. It's been really useful for us in terms of the insight that comes out of this for communicating with our members as well. It was a big focus for them, new service, new chargeable service. So very keen to see how this is being received by the residents. So, on a weekly, monthly basis, we could go in and see we've had this level of take-up from the previous year, and you can see these parts of the borough where it's being taken up more than others. And then when you start to overlay that with intelligence from other parts of the business, it's useful to see how that relates to the makeup of the properties in the area, those kind of things. And then if you've got properties that don't have gardens, for example, do we then market bulky waste collection services in that area rather than the garden waste service? So it starts to bring a different dynamic to your marketing. You make it more specific to what the data is telling you.
Fantastic. Can I move on to Joanna and Carla? So tell us about the project you've been involved in and how that's worked.
Okay, so Delta Connect is an innovative programme that we've rolled out for the last few years across health and social care, locally in Carmarthenshire and slightly further afield in West Wales. A regional approach to providing a slightly different model of health and social care where we're focusing on being proactive and preventative in the approach, as opposed to what we've traditionally been from an alarm receiving call centre, which is what Delta Wellbeing is, and being reactive. So we focus on assistive technology, so lifelines and sort of telecare, telehealth, which has traditionally been waiting for something to happen for a client, and then we actually then will react to that. So although that's still an essential part of what we do, the project has allowed us to be more proactive and preventative. We have wellbeing plans that are actually linked to the individual a little bit more, what matters to them, how we can support them to build resilience within themselves, maintain their independence and connect back with the community, but also to remain well at home and safe. The project itself has tech at its heart. It's the facilitator for us to be able to do it, but actually the wraparound service provision across health and social care is probably the thing that actually pulls it all together, really. We provide proactive phone calls, wellbeing calls. We have a response service, so they've attended over 9,000 call-outs in the last couple of years, predominantly for fallers who would invariably be on the floor for a long period of time because they won't be prioritised by our ambulance service, understandably. But it means that we're able to go out them under an hour, pick those individuals up. They're not conveyed to hospital. They're not then inevitably pushed into wards and then in hospital for a long time because they can't get back out again and things like that. So the service itself is about that, you know, being preventative as much as we can, and allowing us to sort of ensure that that individual has the right support and that wraparound with health and social care sort of colleagues then, really. In terms of data, alarm receiving centres have been hugely data rich, but people tend not to do a lot with that information. That historically that has been the case, but this is allowing us to actually sort of dig down into it, use that information that we're getting to be proactive. Like the proactive calls allow us to potentially pick up on triggers for crisis. If we're actually having regular interactions with clients, we understand the clients better and are able to then actually provide that wraparound at the right time and also step away when we're not needed. So this isn't about continuing to provide that long-term care necessarily. Absolutely, individuals that require that statutory service level or interactions with health, they get through that sort of gate, but we're here to try and delay that intervention then as much as possible. I think historically we've had that, you know, let's give a little dollop of care because people need something, whereas Connect now actually keeps them away from that statutory service provision and provides them with something that actually is probably more suitable for them rather than pulling into sort of services that they don't need then, really. And I think the project where it started, yes, we've achieved what we needed to there, but actually we've had a huge sort of beneficial relationship with both our health and social care colleagues. And so Delta's a local authority trading company, so we sort of sit outside of it, but we're wholly owned by Carmarthenshire, so we've got quite a unique relationship with a foot in each door, but it allows us as a company to have that 360 view of our clients. But then it allows then a lot more partnership working with some of the work. And I'm going to hand over to Jo because Jo will be able to tell you a little about how it's evolved then really into the service that it is now.
Thank you, Carla. Yeah, so Carla mentioned the wraparound health and social care services that are an integral part of the Connect programme. So in terms of that wraparound, then over the last 12 months, we've been developing a home first pathway, which is essentially an urgent and intermediate care response in Carmarthenshire. So it's a single point of access. We've got an actual co-located hub in the same building actually that Delta are based in, so that's extremely useful from a partnership perspective. It's a partnership approach across health, social care, Delta and the wider third sectors. We've got individual organisations such as the British Red Cross involved in that, and the whole point is to look at avoiding admission to hospital where appropriate to do so. Of course, we recognise that individuals sometimes do need acute intervention, but it's really important that they go in for that episode of care and then they come back out and go home where they belong. And also then to expedite discharge from hospital for individuals that are ready, medically optimised, we use the term, but it's medically well enough to leave hospital and then continue their rehab or care journey in an alternative setting. So that team then brings together a number of multidisciplinary professionals in the community. We've got GPs, we've got advanced nurse practitioners, an advanced paramedic in the team, nurses, social workers, social care reablement services, Delta from a response perspective. And we've also got opportunities within that team to trial new roles. So working really closely with our Delta team, then we've been able to trial the roles we call Blue Brigade, Blue Army. They're actually wellbeing officers that are based in the hospital wards. And their role is to really kind of work with individuals, patients on the hospital wards, to identify what matters to them, what's important to them, to get them home. And then to obviously look at, where possible, triaging out to formal care and support. So again, that preventative, proactive approach to seeing what can we do to support individuals, what's within individuals' gift as themselves, what is their proximal support, so their family, any friends that can do to support them to get home, and then looking at third sector tech provision before we go anywhere near commissioned formal care and support services. And we all know that commissioned services are finite resources. We know that we're struggling to get teams on the ground to deliver social care, for example. Similarly, staffing resource challenges in the hospitals. It's really important that we only prescribe care for those that absolutely need it. So it's really that preventative angle then.
We have a delegate question. What are the long-term consequences if we ignore digital transformation?
Oh, that's quite a big one, isn't it, really, I think?
It is.
So personally then, I suppose, and I know COVID is still being talked about, and I think that's quite obvious, but I think COVID actually forced the hand for a lot of services that they needed to move forward with regards to that. And I think probably without it, we probably wouldn't be where we are in a lot of areas, if we're being honest. I think, it's changed the way that we work. And I think if we ignore what we need to be doing, services are going to fail at the end of the day. We haven't got the budgets, we haven't got the workforce. We need to use our finite resources in a better way, use them the way that we need to use them. And I think I've heard a couple of other colleagues with us saying things that actually it's more of a risk not to do something different now than it is to stay the same. And I just don't think we can stay the same. And digital allows our workforce to have the tools to work more efficiently, more effectively, but actually the outcomes for that for the individual are much better, as well as there being better outcomes for the service provision as well, really.
We have another delegate question. How do you get residents to trust you with sharing their data? How do you ensure they know you are using it ethically and safely?
Well, I can comment as well, but go on, Craig.
Yeah, I think having your policies clear around that and you setting that out up front, but also demonstrating that by using it for the purposes that you said you would. So certainly for the service I was talking about earlier, we communicate just about those service-related issues. It doesn't go into a wider pool of you're getting loads of contacts. So I think it's doing what you say and demonstrating that you are following those policies so that you can be a trusted organisation with that data.
Yeah, I think from a health and social care perspective, it's quite, there are significant worries and data sharing across even health and social care is a challenge for us. I think, though, probably if you speak to the majority of patients, clients that interact with health and social care, they don't want to be telling their story over and over again and telling the same thing over and over again. And I think we still have that as a challenge in terms of we're on separate systems. How do we get those systems either talking, or how do we find a way to pull that data and fuse that information so we can actually make the right decisions with the clients and patients for their best outcomes then, really. But again, it is about making sure that you're using the data appropriately, getting those permissions and consents, and then ensuring that you've got all the governance in place. Governance governance didn't go out of the window during COVID, but actually the barriers were dropped quite a lot because people had to work differently. I think there is a risk of us going back too far to the old way, and I think we need to find better ways of actually sharing that information. And actually one of the projects from our local sort of health board area is looking at using that data and providing a system that we're never probably going to get, or it's way off having a system that one and all uses at the moment, but actually utilising things like that AI, that automation, robotics in terms of pulling data from lots of different areas to then have that 360 view of an individual is probably the way forward in terms of that insight as well then, really.
It's an important question, isn't it? We all talk about the new normal. However, there is a race back to old normal.
Yeah, there is a little bit.
How do you stop yourselves retrenching, fossilising, going back to what was, rather than staying with where you've got to and advancing from there?
So from my perspective, for my services, digital transformation is part of achieving the future, the new normal. With the challenging financial environment we're going into, this will help me deal with those challenges. So, looking at things and continually reviewing, looking for new opportunities, overlaying the lessons we've learned with services like this and expanding it across the portfolio of other services will be the way that we tackle some of those issues. So I think it's absolutely in our own interest to not stay where we are and forge forward with these things. So they are an opportunity area. Are
there concerns amongst members about how far you go in terms of social care?
I think we're quite, perhaps I don't know whether it's unique, quite lucky, but we've actually, our sort of senior management teams, our directors, have got a very strong partnership approach to that. It's nice to have health and social care on the same page a little bit, really. There are absolutely different challenges because obviously we're completely different services in terms of what we end up providing, free of point of access from a health perspective. Social services have got eligibility things, but I think there's a joint sort of vision in terms of how things move forward. I think, and culturally, I think for us from an operational and staffing point of view, I think you made the comment the other day, you wouldn't, your staff would probably, you'd have sort of, hysterics if they said, well, you're going back to working on teams and not being in the office together. Because I think it's...
Co-location is so important actually to where we've come from. I don't think we'd have been able to achieve what we've done over the last 12 months if we had not been co-located, but also the digital infrastructure to support the remote working as well, because obviously we're quite a large county geographically. We can't have everybody in the office at the same time, so that digital infrastructure is really vitally important, and going backwards isn't really an option for us. Our challenges are significant in terms of demonstrating the ability to deliver social care, health in the community, but also staffing, recruitment, retention challenges that I know everybody's facing across the board, not just in health and social care. So actually we're taking things a step further now, and we're developing, on top of our single point of access, a clinical streaming hub, which will actually bring all of the WAS, Welsh Ambulance Service, 111 primary care, so GP referrals all into one hub. So you'll have senior clinicians actually triaging in one place. So that is being prudent with our resources because we haven't got enough to share, so that everybody's triaging in different elements of the county. We'll have one place, and then we will almost have a funnel out from there then into the correct pathway. So it's developing that single point of access even further. And that's
sort of hearing that the pandemic has been an enabler. So there are many downsides to the pandemic, absolutely. But an enabler in breaking some of the barriers. Is that true in your authority?
With a lot of frontline services, they kept operational through the pandemic. I think in terms of what we're talking about today, I think for me, it's how I can make the service area more effective for our customers, our residents, but also how we use our resources intelligently. So rather than working to schedules and just going to a location routinely, you actually start to look at the intelligence, the data, and you put your services to where the demand is needed. I think equally, a piece of work we're aspiring to do is connecting the front end, the customer contact centre, to the back end, so that we can deal with issues at the first point of contact or enable the customer to self-serve. So, having information about miscollections, or if a container's gone out on the wrong day, that can then be presented to a customer online so they can self-serve. I think that, for me, is the journey we're on to become much more effective for our residents, using your resource much more intelligently, getting a bigger bang for the buck.
And are these projects part of an overall strategy for your authorities, or are they very much standouts? Is it part of an approach, or?
So the project itself, Connect, was through transformation funding, but actually everything that we're doing is linked back to that strategic vision and national vision, really, in terms of that. So there are digital strategies, etc., but actually it's about ensuring, we all are probably aware of those strategies, that sit nicely on the shelf and don't necessarily get achieved then really, but I think it runs through sort of, you know, nationally, regionally and locally in terms of that. So I think, but because we're all talking and like I said, all of the directors and everybody at these sorts of levels, we're all on that sort of same page. I think there's much more connectivity between those strategies to ensure that actually those, you know, less silo working then, I suppose, in terms of some of those projects and making sure that it connects up. And I think Connect has evolved from what it originally had planned to do, and there's been an add-on and an add-on and add-on as things have expanded, and actually, you know, it's been a bit of, well, what's the worst that can happen? Let's try this and see whether it works. And yet we've had some learning from it that actually, yeah, perhaps that's not the way that we need to do it. Things sound great in theory, don't they? But then you put them in practice and sometimes it's not quite where you need to be. But I think certainly from a Delta perspective, we're fairly agile in the way that we work and we'll react and respond. And I think that's what it's about. It's about, you know, learning as you're going along, art of the possible, isn't it? What can we do really to sort of change things? And as I just said, I think it's more of a risk if you don't change than it is if of actually trying something different, really. Yeah.
We've got just a few minutes to go. If you were starting again, what would you do differently? If we just go across the three of you.
Potentially start a little bit earlier with the hierarchy being more towards digital, online and digital, placing a bit more focus on data quality and getting that right in the first instance, I think would be, you know, the bits I would focus on initially.
Yeah, gosh, that's an interesting question, John. Yeah, I agree. I think starting probably a little bit earlier from where we already started, because we know that the outcomes for the individuals are so much better when you've got that single point of access to actually referring to you know, hospital discharges. To give an example, previous to what we've got now, you had ward sisters just running around not sure of which direction to send a patient, and you had multiple referral points to get into intermediate care. Now we've got that one single point of access, so they don't have to worry about what the patient needs when they exit hospital. They just need to flag that patient needs something, so they can do what they need to do on the ward, and we do what we need to do in the community. So it's all around prudent healthcare and making sure that we're making the best use of our resources in a time where it's unprecedented.
Yeah, I agree with both points there. I think for me, data and evaluation is key, and a lot of projects that start. I think evaluation is normally a little line at the bottom in terms of that, and I think understanding what the outcomes are from the onset and making sure you're collecting the right data, but also having something to compare back to, because actually, bottom line, we have to make those business cases to ensure that that sort of funding or the people and resources put in that right place. And yes, we can show those outcomes, but we've also got to make sure that we can show what added value we are actually provided in terms of those. So yeah, I'm a bit of a thing with regards to that evaluation and making sure that you can actually show the benefits of something that you're doing, really.
Thank you. We've come to the end of our time, and I do thank the speakers for their candid description of their projects. Obviously, they're around if people want to ask more questions. I'm sure they would be happy to answer those. This segment has identified how digital is being implemented at the coalface, and it fits within the strategic approach that iESE has identified in the white paper. There's also transformation, so not digitising what you already do, but actually transforming the services so that you're actually using digital to deliver better. So the next breakout session is on rolling transformation, and that will allow you to have a look at how transformation is being taken forward, but not just on a project basis, on a continuous improvement basis. And that's a very different kettle of fish to taking a transformation project from A to B. Actually saying you're continuously transforming is a challenge in itself, and that will be dealt with in the next rollout session. So I do thank you for your time and your input today, and I look forward to you attending the next session. Thank you.